Welcome back. More than 6 million Americans 65 and older live with Alzheimer's, and now an eye-opening study shows the city of St. Louis has the highest rate of Alzheimer's among Missouri residents. St. Louis County isn't too far behind, though.
It's because the county is in second place on the list. A new observational study at Washington University says factors like income, race, and education all play a role with treatment and diagnosis. All while WashU conducts clinical trials on a drug that could help drop that higher rate.
I loved it. I'd still be there if I could.
71-year-old retired principal Susan Bell noticed something felt different about 4 years ago.
Just the forgetfulness was probably the first thing.
She was diagnosed with Alzheimer's, so she and her husband Ken have been making the trip to WashU's clinical trials unit ever since.
We were just looking for anything that might potentially help.
And I think this is just the beginning.
Susan enrolled in the lecanemab trial Clarity, where she met Dr. Joy Snyder. The same trial instrumental in getting Leqembi FDA approval in June. For the last 4 years, every 2 weeks, Susan gets an IV infusion of lecanemab. The results show the medication slowed Susan's Alzheimer's by almost 30%.
Ultimately, we hope we'll be able to either significantly slow down the disease or stop it, and maybe prevent it in people who don't yet have symptoms.
The approval of this new drug comes as a study from the Alzheimer's Association shows the highest rate of the disease is here in St. Louis.
How big of a concern do you have that you're seeing the highest rate in Missouri is St. Louis City, followed by St. Louis County?
We have work to do, and there's areas of our city and our county that are hard to reach.
According to the study, 14.5% of the city of St. Louis residents 65 or older have the disease. Rates in St. Louis County fall between 12 and 13%. The national average is 10%.
The challenge we still have in St. Louis City, I would say, is getting that early and accurate diagnosis. So a lot of the families that we talk to, maybe they do start seeing some of those early signs, but a lot of times they might get brushed off as to part of normal aging.
For Susan Bell, she's thankful she didn't brush off those first signs and says it's her goal to help clear up the mystery around Alzheimer's.
I wouldn't be in this unless I felt that I could do some good. And from that standpoint, I feel like I'm helping.
Dr. Snyder hopes lecanemab will get FDA approval later this year. In the meantime, you can get Leqembi. Again, it was approved earlier this summer. It's not for everyone, so you'll want to call your primary healthcare provider and figure out if you have mild symptoms and if you're eligible for that infusion treatment. The association also points out that Black Americans face about double the risk of developing the disease compared to white Americans, and Hispanics face about 1.5 times the risk. I'm told socioeconomic factors and lack of quality health education could be to blame.
Well, would you like a